And when we talk about our moms, it's more than just the pregnancy. Oftentimes we focus on the pregnancy, and that is important. But I also want to help us to look even beyond pregnancy, to look at the health of moms throughout her lifetime. A mom is always a mom. She no longer becomes a mom just because of childbirth. She continues to be a mom for her entire life.
This matters, this community, locking arms and sticking together, it matters. And we're here together. So thank you for the opportunity to stand up and play a small role in recognizing that mission. God bless you.
These beautiful young mothers and babies should not have lost their lives. The Latina Maternal Health Fair is a project that we've committed to in order to bring families the information and resources that we need to help receive the best possible care. I'm so happy to see all of you here today.
Hey everyone, thank you for joining us again. This time we are heading north. Did you know that May is Latina Maternal Health Awareness Month? If you didn't know that, you're going to learn that and much more as we head north to support Save a Mom, Save a Family nonprofit who continues to do the hard work of raising awareness of the high maternal mortality rate in Central Valley and continuing to describe and share with our politicians as well as our communities the challenges of being Hispanic in the United States and receiving maternal health care. So we thank you for joining us. There's no doubtly going to be a lot of things you're going to learn today. So sit back and enjoy today's recap episode. And don't forget to click subscribe.
The Latina Maternal Health Fair. Demi and Malachi and Sabrina, Celeste, all the mothers that have lost their lives to not being heard, medical negligence. Come educate yourself. Come out here to support the family. Save their life. Look at these nurses teaching people how to read their blood pressure. Teaching them to do it properly. Things that doctors don't do. This is so important. This is for the community. This is all drawings giveaway. We're giving 5 drawings, 5 photo maternity suits. Woo! Thank you, Jesus.
Tracy Dominguez and Xavier De Leon. Honorable Chairman and colleagues, I stand before you today with a heavy heart to proclaim the month of May 22 as Latina Maternal Health Awareness Month in Kern County. The goal of this proclamation is to not only educate the community of the disparities facing Latina women in the healthcare industry, but also to help give Latinas the support they need to ensure they receive adequate healthcare both during and after pregnancy. Although Latinas account for over 50% of births in California, over 50% of births in California, they face some of the highest inequities in prenatal care. In fact, Kern County has the second highest infant mortality rate at 6.1 births per 1,000.
Look who is in the room supporting Nikki Avila, Michelle, all of you who have come together to support our community, to raise awareness. Kern County does not want to be known for having the highest maternal mortality rate. That is unacceptable. So together, let's keep moving forward. And Tracy, thank you for your role. Would you please join me up here? And on behalf of the city of Bakersfield, just want to recognize your efforts with Save a Mom, Save a Family in honor of the 3rd annual Latina Maternal Health Fair in recognition of your dedicated service to the city of Bakersfield and recognition of your continued commitment to advocating for those who have suffered from maternal mortality and other healthcare related injuries, and in recognition of your efforts to empower mothers and their families with support and educational resources. Tracy, it's my honor to be able to present this to you and in recognition of all of those who stand with you.
With you guys, to make the changes for all mothers, that's where it actually starts beginning in the legislation and fighting. And I thank you guys for fighting and trying to make new bills that will protect mothers and babies from the harm that our families received. And I think that's a pretty big mountain to climb, but you know what, God will make a way. He's made a way. All of this is God's story. This has always been God's story. He's always opened the door. He's always made a way for us to have the opportunity to share our stories wherever we can. And I truly, it's all God. He picked me up off the floor, literally, and here I am now still fighting. And I will continue to fight. I have grandchildren, and I have a reason to live. And it's just to, the purpose in someone else. If one person walked away listening and made a difference in their life, and my job is done here. All of us, just takes one person to understand. You can just tell Demi's story and it can change. Oh my gosh, my friend had that, or Sabrina's story, or did you hear about that? You kind of check it out. Ask your doctor. If he doesn't listen, you go to the next person. You keep advocating and advocating and advocating, and they'll listen finally. If not, we'll find a way. You call us and we'll find a way to make you get the help you need or address you to the right direction. But thank you both, all of the senators, legislation, everybody. Thank you very much. Be part of the Dominguez family.
And now I would like to welcome Bianca Ruiz, and she is going to be telling us the story of another mom who lost her life. But not only is she doing that, she is a nurse and going to be telling us kind of the medical side of it as well. So please welcome Bianca.
Good afternoon, everyone. My name is Bianca. I'm standing here today on behalf of Sabrina De La Rosa.
Okay.
Sabrina De La Rosa was my best friend who grew into my sister throughout over a decade of friendship. I never thought that Sabrina would be a statistic in the most unfortunate way. Especially when I have been in the delivery room with her, holding her hand as she brought life into this world. January 10th, 2020 was supposed to be just like the other 3 times that she gave birth, but it wasn't. There's so many reasons why Sabrina and many other women aren't here today, but here are a few. Systemic racism, medical negligence, and the medical boards across the country that are supposed to protect patients instead they allow repeat offenders to continue practicing medicine. There are many horrible things from the past that affect how women of color are treated today, especially the topic of gynecology. There is a man by the name of James Sims, a white physician who performed experimental gynecological surgery on enslaved Black women without anesthesia. His belief was that Black people didn't experience pain like white people. And it's that kind of belief that has led us to the current state of systemic racism that trickles down into healthcare. Racial and ethnic disparities are built into the policies, practices, and procedures of healthcare systems, which lead to unequal access to healthcare services, whether it's mental health or just a clinic or things of that nature. You get undiagnosed, you go untreated, and these outcomes affect the marginalized communities. As mentioned earlier, Kern County has the highest maternal mortality rate in California, and the numbers aren't going down. Many changes need to take place. These medical boards have to do better in regards to who they allow to practice and investigate the complaints that have been made. Many laws need to change, and we as the marginalized communities need to occupy the spaces of politics and healthcare to help make these changes so that our future generation doesn't have to suffer. In closing, I appreciate everyone here today and everyone trying to make an effort so that there isn't another Sabrina Del Rosa on the news lines, or a Demi, or a Malachi. Thank you guys.
October 28th, I was first to the emergency room, Kern County Medical, KFC. I was 36 weeks, pre-active. Doctors took me in. Took them at least an hour and a half for them to actually put me in the, delivery room and everything, set me up. I had a cerclage, so obviously I couldn't have natural birth, but we were waiting for me to give natural labor. So it took about an hour and a half for them to start, putting everything on me. And it was a traumatic birth. Horrible. I still, have a lot of anxiety, postpartum depression, and go through a lot. But today, I said I'm gonna make it today because I want to have voice, not just for Liam, for all of here. So I don't think it takes a mom or a baby to have a picture this big in order for Kern County to realize how bad the situation is. How far does it have to get for Kern County to realize that we do have a lot of this going on, and that we need to be, here, someone to hear us. I really appreciate all the help that I see here, Veronica, and all of these, that are here to help us, Sorry, I'm not a speaker, on this. I have so much going on, but I want my voice and everyone that has suffered, that been through this kind of stuff, that they're not alone. And sorry, it's okay. But it's so much that we go through as women, and sometimes we think that there's nobody else that's gonna happen to you, and that it only happens to certain. No, it can happen to any woman, and I had it all planned what I was gonna say, and I'm sorry. I am here to, say that we want this to get big. We want to be here, and that, that it doesn't keep happening. That there has to be good medical, personnel here, and OBs and everything that can say, hey, no, this is time. You need to go and get checked, or and that negligence and that all that doesn't happen, in hospitals and stuff like that.
We now have Dr. Taska Moore. She's an OBGYN.
Hi everyone, thank you so very much for having me once more this year. Honoring your losses. I'm sorry, I feel the pain in this room. I do not take it lightly to be here to stand before you. As you can tell, this is dear to my heart. Thank you to Michelle. Thank you to Tracy for having me here today. Tears are okay. It means we're human. It means we have feelings. And it means that we get to make room in safe spaces for us to respond to losses. My hope today is that we can continue to collectively work together so that we can make a difference for all our moms. And when we talk about our moms, it's more than just the pregnancy. Oftentimes we focus on the pregnancy, and that is important. But I also want to help us to look even beyond pregnancy, to look at the health of moms throughout her lifetime. A mom is always a mom. She no longer becomes a mom just because of childbirth. She continues to be a mom for her entire life. And every mom brings forth the next generation. And so it's important for us to start to look at things transgenerationally and not just in our particular time frame. So last year we talked about sort of where we are in healthcare with regards to maternal health care. And I gave some stats about disparities. This year I want to focus on where we are now, give a little bit of a status update, and hopefully collectively come up with plans that we can continue to move forward. So as you guys remember, we all experienced a pandemic, and while there were many adverse outcomes as a result of the pandemic, and for many of us, our lives changed for different reasons, right? During the pandemic, something interesting happened. The world stopped. And despite the maternal mortality issue being known for decades, it allowed us to really be able to hear and listen to each other, to be aware of the maternal mortality crisis in the United States. And for many of us, it was the first time we've ever heard of those statistics, ever became aware that there was, in fact, not a problem, but an actual crisis. Since then, we have learned that the latest stat shows that the maternal death rate is 32.9 deaths for every 100,000 births in the United States, making us the worst in the entire world in comparison to other developed nations. In fact, there are undeveloped nations, quote unquote, that are much better at maternal health than we are. Sadly, we learned the disparities with regards to maternal mortality rate. We learned about the 3 times higher rate of Black maternal mortality in comparison to white counterparts, at a rate of 69.9 deaths out of 100,000. We also learned that more than 80% of these deaths could have been prevented. And that's where the hope lies.
And I knew that we cannot do the same thing and expect a different outcome. So I decided to organize a campaign, Bakersfield Families Call to Action, with the Dominguez family, the De Leon family, and the Hines family. We worked on an online campaign, Monique walked door to door, and we had the support of the Change.org petition as well. The goal was to get the support of our local elected officials, to put pressure on the medical board, to elevate our complaints to high-profile complaints, and to spread the word about the importance of advocacy and knowing that you have rights as a patient. I worked with Tracy, Xavier, and Monique on the medical board complaints. Yes, when we find ourselves in situations like they have, and I have, where we walk into a hospital and leave forever without our loved ones, we know we need to do something. Many people think about contacting a lawyer first, and that's something you definitely should do. But ultimately, that will not discipline the physician. In time, you know you need to do more. That's where the medical board comes in.
So today, let's look at what we've done so far. Many of us know that there has been an increased rate of home births. So there are women who are looking for safer options, and home births have become one of those safer options. We've noticed a significant rise in recent years. Now, ACOG quotes about 35,000 births per year are home births. But just as Xavier mentioned, we have to pay attention also to infant outcomes. And while there has been lots of publicity about home births and increasing home births, and it has decreased the maternal mortality rate and complication rate, it has, however, increased neonatal adverse outcomes, and that's the part of the conversation that's not being had. So there's an increased risk of perinatal death with home births and an increased risk with neonatal neurological adverse outcomes like seizures. It's important for us to tell the whole truth, because part of moms being able to be informed decision makers is that they have both sides of the story.
So what did I mean by that? Let's dive a little bit deeper. We know that racism is the main problem when it comes to healthcare in America. It has been linked to a diverse number of outcomes in a variety of marginalized groups. However, what we do not want to happen is that we swing the pendulum so far in the opposite direction that we also put women at risk for adverse outcomes. What do I mean by that? There are concerns, deep concerns, proven over and over again, validated now with studies and outcomes, that racism leads to adverse outcomes in healthcare. And there is a need for a complete overhaul of the healthcare system in America. What we do not want to do is to try to make other options appear to be appropriate for all women and not provide the actual truth about the outcomes and those who may not necessarily have the same outcomes as others. We know that on social media, you will almost only see the good outcomes. It's very rare that women who have opposite outcomes will actually share their experiences, or they share them less often for a number of reasons. And what I have personally noted is that there's certain medical advice being given by non-medical clinicians to try to sway individuals into certain types of decision making. And while home births, birth centers are great options for the appropriate patients, there are some patients that require a higher level of care, and it's important that we're honest with women about that. Even though there are a number of women who may want home births and birth in a childbirth center, and many will qualify, there are some who just would not be safe in those settings. And it's important for us to provide that information for them. There are other decision making about childbirth and pregnancy that are important for us to share the whole truth. So not treating your diabetes is going to lead to adverse outcomes, even though you may feel uncomfortable about the options that are being provided by the healthcare system. So that's what I'm getting at, is women who are now trending in making the decisions that are actually potentially harmful for them and their children because they're not being given the full truth, and instead are being swayed to make this certain decisions that are trending. Trending is not always safe for everyone. So let's just give women the whole truth so that they can make the right decision for them.
And do you want to learn about having a midwifery? Here's the place to go. There's so much more in here. There's so much postpartum. Malachi's picture. We have more in here. We have more education. We have more resources. We're growing, and we're just trying to make a difference in the world. Just one mother at a time. We have this is Zoe's bracelet. Look at all the bracelets she's making for everyone because she lost her auntie to maternal mortality, and this is her aunt over here. This is her mom's table. This is for Sabrina. Look at how beautiful she was. She left children behind. Her daughter will be speaking on behalf of her mother.
Mommy didn't make it because the doctor gave her too much medicine.
I know that your mom went to the hospital twice that day. What did your mom tell you after she came home the first time from the hospital?
That she was in so much pain.
Could you tell the difference in your mom when you saw her when she came back from the hospital?
Yeah, she didn't want to be bothered. She couldn't move. She wasn't hungry.
now that you've seen your mom advocate, your grandma advocate, and your auntie advocate, what do you think happened to your mom?
I think that she went to a place where she thought she could trust people and they didn't care.
What do you think needs to change, Desiree, so other daughters don't lose their moms too?
I think that they should do their research on doctors, know who they can go to, make sure they're able to trust them. It was important for me to be at the fair because my mom's story needs to be heard, and what happened to her is not okay.
This is just what life's about, people. You know, show the support for your family and friends. You know, everybody always talks about what can I do? How can I help you? Well, help us by bringing attention to this. Help us by showing that you care. You know, but you know, Demi loved everybody in her family, and she deserves to be supported. I guess that's the word. That's Demi. That's Sabrina. That's Malachi. You know.
Patient advocate, and my grandson is Malachi DeLeon.
My name is Xavier DeLeon. I represent Malachi DeLeon, my son, and I'm also a patient advocate.
I would like to see more resources, more accountability, more availability, more people not afraid to speak up when they feel like something's not right or they're unsure with what was said to them. I would hope to feel that they feel empowered from hearing our stories or, you know, coming to our events, and to know that they have a voice, to know that they can speak up, to know that they don't have to stay with that provider that they're with, to know that they can change, that they can feel confident with the way that they're feeling, the way that their body's feeling, and not be afraid to walk out and say, I'm not doing this, I'm not comfortable with it, I'm gonna find somebody who hears me and who wants to work with me with my birth and my labor and my delivery.
Xavier, what would you like to see change? What do you think needs to change?
Well, my mom hit it right on the head, but to get more specific, I would say what I would want to see change is babies' rights being taken seriously as well. I mentioned earlier that I'm experiencing my son being denied his basic right. So I would like to see some change in that, and like she said, just accountability, a little bit more resources, and that's why we were here today, to help out the community with that. And not just change to have change, but change to be impactful, because I think anybody can change just to kind of fly under the radar, but we really want to see change to see the community improve and the stats grow on the better side, not to continue to get worse.
Oh, it's a mission. It's not going to happen overnight. It's something that we do every day in and out. We plan for this. We get our vendors. All these photo shoots, maternity shoots, first pregnancies are donated by people who have and want to make a change in the world. You know, Penelope, she does a stillbirth. It's called Lay Me Down to Sleep. If you in that situation where you lost your baby, you know, she will go in and take pictures.
On that day, I had the pleasure of meeting Trinity Brown, who later gifted us donations from her organization.
I am the founder and the CEO of the Noel Alexandria Foundation, and we provide services to families that have experienced pregnancy and infant loss. We provide free educational, emotional, and financial services to help with burials and cremations.
We're just excited for another year to be able to bless families and be that support that is needed.
You're welcome, honey. She's got a business. Good for you. And there's so many opportunities to learn, so many opportunities to be part of this. You know, all you have to do is call and ask, hey, I want to be part of this. I want to make a difference. I want to do something.
Then we saw a rise in doulas, and I love me some doulas, you guys. Doulas are a saving grace, and we have seen that statistically, right? So doulas are a part of the solution. We've noticed a rise in doulas of various types. We've seen the full spectrum doulas, we have seen the birth doulas, we have seen postpartum doulas, and we're seeing abortion doulas. So there are different types of doulas. We're learning that doulas have significant impact with providing advocacy, information, pain management support, emotional support, and physical support. We know that statistically, the involvement of a doula in childbirth decreases the need for analgesics, shortens the duration of labor, decreases the rate of instrumentation, unassisted births, those are your vacuums and your forceps, decreases the rate of C-sections, decreases the rate of low 5-minute APGAR scores, so that's the wellness check for a newborn, increases patient satisfaction, and there was a 2017 Cochrane Review study that looked at 26 randomized controlled trials. Randomized controlled trials is sort of the golden type of study. So the studies that are more reliable, that where we can put our hat on the outcomes. And that showed, also confirmed that there was a decrease in the duration of labor, and also an increase in patients in the patients of the progress of labor. So we're seeing good outcomes across the board, but why isn't doula access available to all communities? There's a financial aspect of it. There's lots of financial pushback. In California, doulas are being reimbursed at the same rate as physicians, as OBs. And so there is some pushback with regards to that. But what the studies have shown is that there's actually a cost savings when it comes to the involvement of doulas in childbirth. So one study has quoted that doulas decrease the cost of birth by anywhere from $900 to $29 up to $1,000 per birth. So there is actually substantial data that shows us that the involvement of doulas does not increase, but actually decrease our costs when it comes to our healthcare system.
Okay, you guys, so I had to hop on here because I realized one of the things I intended to mention in my speech was about the support for midwives and the increasing support for midwives and hospitals that have started to utilize the midwife model or the midwifery model in providing healthcare, such as the MLK Hospital in Southern California. So just wanted to add that in.
C-section rates in 2020 also continue to show disparities, showing that, for example, non-Hispanic Black women had a C-section rate of 36.3% compared to white women of 30.8%. One takeaway, C-section rate is way too high. It's higher than other nations. So definitely that's an area we can look at. But also looking at the disparities, it was believed that Hispanic and Black women had a higher C-section rate because we had more chronic diseases, more other types of complications. But one study also showed that even when we are healthy, we have a higher C-section rate.
Okay, let's dive a little bit deeper in Latina maternal health. So what should you know about this? Well, one of the things that is strikingly alarming is that we saw a significant increase in Latina maternal health outcomes, adverse outcomes after the pandemic and during the pandemic. Before the pandemic, the Hispanic woman actually had really better outcomes than most marginalized groups. And in fact, in one particular analysis comparing the data from 2017 to 2019, they actually had better outcomes than non-Hispanic white women. And for most of the years prior to that, had pretty comparable outcomes compared to non-Hispanic white women. Now, what happened in the pandemic? As we all remember, there were a number of disparities that happened as a result of the pandemic, not only in diagnosing, access to healthcare and treatment, but also in jobs. So we know that the Latina population is a high percentage of those who are frontline workers who work in industries that continued to work during the pandemic and had potentially higher exposures. The combination of those multi-leveled disparities had a significant impact on the Latina maternal mortality rate. So prior in 2019, the rate was slightly over 12%. Then in 2020, increased to slightly over 18%. And then by 2021, you guys, the mortality rate for Hispanic women, 27.5%, a tremendous surge as a result of the pandemic. Let's compare it to Black women who have the most adverse outcomes related to pregnancy. As a result of the pandemic, we also saw an increase in the maternal mortality rate among Black women, with a surge of about 25%. That surge in Latina population accounted for upwards of 44% increase in the mortality rate, the highest surge amongst any marginalized group. Now let's talk about outcomes and things that affect the Latina population. While Black women are more likely to experience hypertensive disorders, Latina women are more likely to not survive hypertensive disorders. This was mentioned by the American Heart Association. Other outcomes we should look at. We know also that diabetes is common in the Hispanic population. And we know that for women who experience gestational diabetes, there is an increased lifetime risk for type 2 diabetes. The American College of OBGYN has quoted that this prevalence can be anywhere from 15 to 70% increased risk of developing type 2 diabetes at some point in their lifetime after having and experiencing gestational diabetes. In the Latin American population, that rate of developing type 2 diabetes is 60% within 5 years of having gestational diabetes, an alarming number. But there are things we can do. For example, we can maintain healthy lifestyles even after pregnancy. We can support moms to breastfeed. And while the studies have not been clear as to the outcome of breastfeeding on long-term prevention of diabetes, it is clear that breastfeeding does have a positive impact of improving glycemic control during the early postpartum time period. And this is why it's important for us to pay attention to these outcomes and the diversity of outcomes in the multitude of marginalized communities.
Change. What would you like to see changed?
So what I would like to see changed is first and foremost that when you're in a doctor's office or in a hospital room, that you're greeted with humanity, that you're respected, and that we bring the good bedside manner back and see someone as a human and not just a chart or an insurance card.
Where 53% of deaths related to pregnancy actually occur beyond the 7 days and up to a year after birth. 53%. So the majority of the issues that are happening in that postpartum period. This is where we can really make a difference in the outcomes for moms. What has ACOG done? So ACOG is the American College of OBGYN. This is where I personally go to look at the latest studies and what's been improved and what guidelines are out. ACOG in 2018, subsequent to this information, then put out guidelines that said we need to see moms more and we need to see them more frequently in the postpartum period. Anyone can guess what the leading cause of death in the United States as of the latest statistics for moms? Many will say hypertensive disorders, and that is on the list, that's correct. Many will say perhaps cardiac disease, and that is correct, that is on the list. Many will say hemorrhage, infection, and those are also top causes. But the number one let's see where she was.
Suicide.
Suicide, mental health disorders. Dang, I knew you were here. Number one is mental health disorders, combination of suicide and drug overdose.
In the
impasse of loss, there's also a great need for connecting mental health support. And sometimes it's fragmented. You don't know where to turn if your insurance doesn't line up with that support. And today I felt so much joy seeing other providers and other vendors here saying that they're offering free group support for women who have faced struggles. And I think that that's a really beautiful piece that the community can start providing within our resources and within our desires to help. And so I would love to really continue to advocate for following our hearts, following our passion. I see these ladies who also make these beautiful, treasured gowns for the babies that have been lost. And I have a friend here who told me they have been in existence for many, many, many years, and that it's lovely to see everyone come here together, whether it's in the initial perinatal for in pregnancy and also post-pregnancy, and that women, especially Latina mothers and women, be supported through their struggles and in this community. And so I'm a licensed clinical social worker, and I'm bilingual. I also speak Spanish, so I have the joy of also connecting with the Latina community and supporting them through their perinatal and postpartum. And I would also love to highlight that just like there is like cancer awareness, and there's like cardiac awareness, and all the maternal mental health is also building a lot of traction. In 2022, we had our first national hotline, and now it's for all of us to access. And that was also highlight how communities and people are making small changes, maybe not fast enough the way we wanted, but slowly it's coming together. Some local clinics and hospitals are also having pilot projects that focus on perinatal care. The term generically was always postpartum, and there's a huge awareness that also in pregnancy there's a lot of need, and hence the transition from postpartum now to perinatal, which covers the months of pregnancy and a year post-birth. And so that we could catch the mothers in the beginning, and we could also catch the mothers at the end. And so thank you for having me here, and it was a joy to connect with all of you.
I just want to take a moment and really highlight the work that Veronica does. I think a lot of people know the term postpartum depression, but they don't know exactly what all comes with that, and the fact that postpartum depression isn't just feeling sad, it's not just the baby blues, there's anxieties, there's fear, there's so many emotions that you're feeling. You're coming down from tons and tons of hormones raging through your body to trying to find a new normal, and like she said, things we don't even realize during the pregnancy. Again, a hormonal shift. So you're happy, you're sad, you're just, oh my gosh, what's going on with me? Not realizing that, okay, like maybe I do need to talk through these emotions, because 9 months down the line, these emotions could change. And after I have this baby, how am I going to feel? I didn't expect to sit there and feel sad or anxious, or so anxious and scared that it would then lead me to feel like I was in a fog for the first 5 weeks of my child's life. To not know, to sit here and look back and talk to my husband, him talk about, do you remember when his poop was black? No, I don't. And maybe that's okay, I'm grateful, right? But the other part of me is, why don't I remember that? And why didn't I know at the time or before that there were resources like this, that I could have worked through those emotions in a healthy way at that time? So thank you for the work that you're providing.
Definitely a heart-wrenching day, hearing and listening to the stories of these brave men and women who share what it's like to lose a loved one to tragedies as a result of the healthcare system. And so today we want to take a moment of silence for the lives that have been lost. And in doing so, we remember, and we're committed to remembering, communities like Bakersfield, in a state that's considered to be one of the most progressive states, that continue to experience such marginalized outcomes, adverse outcomes related to pregnancy. This is Dr. T, the hand behind the handle of Healthy Bum Club right here on YouTube and healthybum.club on Instagram. We thank you for joining us as we celebrate and honor Latina Maternal Health Month, and we honor the lives that have been honored today, and we hope that you continue to monitor and stay updated with maternal health in the United States. We'll see you guys when? Next episode.